In pathology, we can get involved in the patient's care pretty early on. We evaluate biopsy specimens every day. We received a lot of what we call diagnostic biopsies. Um, and this can be almost any organ system where there's a suspicion for cancer. A lot of what I do is behind the scenes, as it were, in the laboratory space. But it's important for me to come up with ways to expedite care so that things can happen very quickly. One of the things that motivates me to be a pathologist is I'm able to give a definitive answer oftentimes to a patient as a part of their care, because the last thing you want is uncertainty. And I think that collaboration is very valuable to all of us who provide oncology care. In the Riverside Network, we have tumor boards for most of our hospitals. We pathologists attend and present information at virtually every tumor board. And so even providers and physicians can help the whole team go in a little bit different direction with the complicated patient. Sometimes the surgeon will ask us to evaluate part of the specimen while the patient is still in the operating room under anesthesia, and we can perform a very rapid type of test called a frozen section. And the goal of the frozen section is to be able to render a diagnosis. I'll do that in a very short period of time, and I'll call that result back directly to the surgeon in the operating room so that the surgeon knows, okay, do I need to keep going? Do I have enough? And to help guide the surgeon's hand. So I can sometimes help advise on the next test or the next type of specimen that could help me to be able to fully, give as best a diagnosis as I can. It's important for me to always keep the patient first and foremost in mind every time I'm looking at their slides through my microscope here, or collaborating with others in the laboratory or in other medical specialties to try and always think about how can I help the patient to further their care and with best and most accurate diagnosis I can render.